Rare type of migraine is probably one of the most frightening types of migraine that anyone can experience. It occurs in less than 0.01% of all migraine sufferers. It occurs mainly in women, and the average age of onset is usually between the age of 12 and 17, although it can be older. What makes this type of migraine so frightening is that the symptoms very often mimic that of a stroke, and it's known as a hemiplegic migraine. But the aura stage of this type of migraine typically involves hemiplegia, or paralysis or weakness down the one side of the body, including very often a facial droop. The hemiplegia typically lasts between 5 minutes and 1 day, but in certain cases it can last over a period of several days. It often occurs alongside visual disturbances, coloured spots, zigzags, sparkles in the vision, speech difficulties, the inability to speak or the slurring of words, communication difficulties, the difficulty in understanding language, being able to write, being able to read. Other symptoms include dizziness, ringing in the ears, confusion. How can we tell the difference between a hemiplegic migraine and a stroke? Well, if it's the first time you've experienced these symptoms, you must always get fully evaluated by a professional. So the key difference between a stroke and a hemiplegic migraine is the onset. So with a stroke, it's typically a very fast onset and symptoms appear all together, whereas with a hemiplegic migraine, you often start with one symptom and then you gradually get more symptoms over a period of minutes or even hours. Migraines typically have what we call a positive sensory phenomenon, so things like flashing lights or tingling in the body, whereas a stroke has more negative sensory phenomenon like loss of vision or numbness. And unlike a stroke, hemiplegic migraines, people can experience numerous attacks and be fully recovered between each attack, coming to no harm. There's still a lot of research being done into the kind of treatment for this type of migraine. Sometimes ibuprofen taken at the very early onset of symptoms, particularly when also taken with an anti-sickness tablet like domperidone, can be quite effective in some cases. Other people, it's a lot better if they take a daily preventative medication like topiramate, but each treatment really has to be individualised because there's not one treatment at the moment which is working for everyone.